Hello, and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have another amazing guest to introduce to you now. Dr. Martin Katz is originally from South Africa and has practiced medicine in Virginia for over 20 years. He is passionate about helping patients embrace life and pursue health. Dr. Katz is double board certified in sports and family medicine, a co founder of a successful supplement company, a locally and nationally sought after physician, and medical director of the NICA mountain bike racing in Virginia. Dr. Katz got his before mentioned second board certification in sports medicine after getting somewhat burned out in primary care due to the lack of, quote, health care, end quote. After he traveled around the Western United States, Dr. Katz found his home on the East Coast, where he lives with his wife and four kids. In addition, he co owns a supplement company called Mara Labs, creating biologically relevant supplements that have been scientifically proven to improve cellular health. He is the author of the children's book, Making a Magnificent You, which offers parents a fun and lighthearted way to introduce healthy eating to their children. Its vibrant colors and engaging characters attract young minds, but it's the health conscious parents that the health conscious messages that the parents will love. Excuse me. You can find Dr. Katz on his website at martinkatzmd.com. Dr. Martin Katz, what an absolute honor it is to welcome you to Boundless Body Radio.
Hey, Casey, thanks so much for having me.
It's such a joy to host you. First question, right out of the box. We were talking about this offline. You say you're from South Africa. What happened to the accent, man?
Yeah, it's gone. It's been lost. Years and years of being an American at this point. And again, I don't need to charm anybody anymore. I'm happily married, four kids, and my kids would probably make fun of me if I had an accent at this point. But if I hang out with some South Africans, that accent comes back pretty quickly.
That's good. You say the word charming, and it's one of my absolute favorite accents on the planet. I'm sure you're still a diehard cricket or rugby fan. Anytime those come on, I don't think you can get that out of the blood, even though you've been in America for so long.
Yeah, cricket maybe more the one-day matches at this point rather than the 3-5 day matches.
Yeah, right.
But rugby, yeah, South Africa is number one ranked right now, so
That's
South Africa's
awesome.
going well, and it's just lovely to see, a racially diverse team, which is super cool, getting along, still the Springboks and working really well together.
Yeah, that's amazing. I love that. You and I were introduced through a mutual friend, Dr. Steve Hewlett, who runs an amazing podcast as well. You did an excellent episode with him that I really loved.
Thank you.
I was really enthusiastic to reach out to you. You've got to meet Dr. Steve Hewlett in person. I'm not sure if you've met his wife, Teresa, but yeah, what can you say about Steve Hewlett and his amazing story and his amazing work?
Yeah, it's again, all of us are just trying to help people understand that, medications may be helpful in the short run, but really they're not the answer in the long run. And, we need as many voices talking about this as possible because, it's really, that's where the money is. And that's where we're putting a lot of the money, whether you're talking about the insurance world, the hospital world, the medical world. That's where a lot of the money goes. And there's not a lot of money in lifestyle discussions and helping people understand that they can have a role in their health. So the more voices we have, the better. And Steve's amazing. And what a nice guy.
Yeah, he is such a nice guy. The last episode I did with him, we talked a little bit about those medications and not only the seeming like kind of lack of effectiveness in a lot of them, but also I still just think it's so underappreciated, the side effects that some of these things come with. And people, are doing the best for their health and they think they're doing the best thing. And not only might a lot of these drugs not really work all that well, but the things they come along with, they just think like, oh, I just have to suffer with losing my mind and forgetting things or getting depressed, and like all these stories you hear of the side effects, pretty rough.
Well, I hope we get to this at some point, Casey, but this is one of my loves. It's really helping people understand synergy and really helping people understand there's no one answer. And one thing can certainly lead to another. And if we have comorbidities at the same time, our chance of significant morbidity and even mortality goes up. And so absolutely. And oftentimes, you hear of patients with poor lifestyle, then they're put on a medicine, nothing's done to address the lifestyle. So now you're adding a medication, which in some cases, often cases, have side effects. So they're not necessarily toxic, but some of their side effects are. You look at NSAIDs, which are fantastic short term. My gosh, they have an effect on the kidneys. They have an effect on the the whole gastrointestinal tract. Not not without side effects or not without toxic effects. And now you're having, side effects from that. And where do you go? One of my providers I just started a new clinic, but my old clinic, I just saw a patient and he had an orthopedic injury. He's a smoker. He eats late at night. He was on NSAIDs for 8 weeks. And, he's in his 50s. And, talking to him, the provider decided that it was probably a gastric problem. But then his symptoms progressed. Lo and behold, it was a cardiovascular problem, which who knows what that came with. Certainly one toxin on top of the other. But you look at him, he's bearded, he's a good looking guy, he's, muscular. You look at him, you're like, that guy's pretty healthy. Blood pressure was okay. His lipids, Casey, were unbelievably good. I reviewed this guy's chart. They were, 140s, 150s, decent HDL, decent LDL. I don't think they had broken it down to ApoBs and lipoprotein A's because that's not what most doctors do. But, looking at his baseline lipids were pretty good. His HSCRP was even okay. I mean, it was remarkable. So, we're just adding one thing on top of the other, and it makes the whole system pretty hard to diagnose, pretty hard to treat. There's a lot of problems within the medical society when we don't really just go back to basics.
That's such a good point. Yeah, that negative synergy. You think about, all the side effects we know from one drug, which you probably don't even understand that many of them anywhere, how severe they are, maybe they're underreported. But then you start to combine these molecules with other molecules, and then you have these infinite number of possibilities of things they can do in the body that you could never really understand. So I really appreciate
Yeah.
that. Go ahead.
Yeah, I mean, for my patients, I try to help them understand it in day-to-day living. If they're driving down the road and they're doing the speed limit or maybe 5 to 10 miles over the speed limit, but they're, have maybe an adult co-pilot with them who's also watching the road, and they're watching the road and they're super in tune with their driving and they've been driving for many years, the chances of something bad happen pretty minimal. But if you increase your speed significantly, you're distracted by a phone, you don't have that driver next to you, didn't get a great night's sleep, you just got in a fight with your girlfriend, maybe you had a beverage with a friend. Now you're adding one thing on top of the other. It's your chance of having an accident or go up. Now you figure, now you're going on a bridge, maybe the guardrails down the bridge, you just add these things. And or there's a curve or there's ice on the road and there's big trees, and now if you leave the road and hit a tree, your chance of survival going down versus a straight road. It just helps people understand, the more things that we add negatively or the reverse positively, it has a real effect.
I love that analogy. I hope you don't mind if I steal that one. That's a really good way to think
No,
about
not
it.
at all. Yeah.
I appreciate
I
that.
also I also use it for understanding what's under the hood of the car. We really need to stop guessing about our health. Most of us know how much money we make, how much time we have for vacation, which vacation is a good thing, but how much time we have left, how many sick days, when holidays are that we get off and what time we get off and the best route home. But how many of us really know what our blood pressures are, what our glucose is at day to day based on what we're eating, what our insulin levels are, what our ApoB are, or lipoprotein A, our particle size, so many things that we just have no idea about. So, it's like going to buy a car. You don't look under the hood and you don't test it and you don't get a report of what's possibly going on with this car. You have no idea. The more data, the better. A lot of times you can get over dated. I understand that, but we definitely need to have a better sense of our health, and most of us just don't. We don't even really understand our blood pressure and how important that is, what our resting heart rate is, a heart rate variability, so many things just so important. Heart rate recovery that you can just test pretty easily, pretty readily, and most of us just don't have an idea.
That's such a good point. I love that. Yeah, I mean, you mentioned those blood markers, and as you said earlier, it's even understanding those blood markers and understanding that most doctors will not even check some of that stuff. Like you said, they might stick with just a typical, lipid panel and not go a little bit deeper for the more expensive NMR kind of panel. And so
Right.
it's even a challenge at that level. But yeah, I agree. You can go too deep in the data, but also it's so important to understand some of the basic things so you can, steer the right direction. And we mentioned Steve, and you were very complimentary of him and how he's sharing the word and how you're doing the same thing. And you guys do have a similar story where you got into a profession where you did it for the right reasons and wanted to help people. And we mentioned in the introduction that you suffered from a little bit of a burnout. Can you describe what it was like to get into the field, what you thought it was going to be, what it ended up being, and how you ended up feeling like you were a little burned out?
Yeah, I mean, I was, allopathically trained in a great setting with a bunch of great people who really, I do believe, mean the best and want to get the best education and do the best for their patients, and still do, absolutely. But after practicing for 6 years, and really the only tools that I had, were prescribing medications, giving a referral to a specialist, maybe doing some diagnostic studies, but really pretty limited understanding of what was causing chronic disease, why people were just coming in with incrementally more chronic diseases, why they were so hard to treat, and then recurrent diseases, depression, diabetes, cholesterol, even though cholesterol is a bit of we'll leave cholesterol out of it. But at that point, cholesterol seemed like this thing we had to address. It was so important to get LDLs down to a certain number. And, we were fighting it. And, people are just thyroid disease, people are just getting sicker and sicker, autoimmune disorders, Lord have mercy, and more recently, neurodegenerative disorders just on the rise. And I just felt like I was prescribing more and more meds because that was my tool. I did like to talk to my patients at that point, even then, but you're fighting a system and you're fighting time within the system. There's so much pressure for us docs to see patients within 10, 15 minutes. Back then, it was a little easier. We were just scribbling some notes down on a piece of paper. And I had a couple of patients who I felt like I was doing a really good job with them. I was managing them really well according to the scripts, according to the PharmDs and the pharmaceutical reps that were coming in, patting myself on the back. But lo and behold, they're not getting better. And I had this one woman who's just delightful. I really liked her and her husband. They would come in oftentimes together. She was elderly. She ended up, we treated her with just about everything. She ended up committing suicide. And it rocked my world. I just couldn't believe that I'd done everything per script. And here was this incredibly negative outcome. So very negative. For somebody to go to that length is just a really dark place. And so, I was like, F this. And, I was really enjoying sports at that time. And I was doing triathlons, and, some of the people I was doing triathlons with would get these chronic injuries. And I was like, I want to do sports medicine. This is awesome. And so I went and did a sports medicine fellowship. But what's interesting there is, guess what we have? We have surgery, we have drugs, and, yeah, we can refer to physical therapists, but we're not the therapists. We could sort of do an exercise prescription, but that wasn't even that high on the teaching. Like, we were just getting taught, sort of how to do these awesome exams, which was great, and how to diagnose people. But then the tools were limited from there. And they've certainly gotten better, but at that point they weren't. We could do a steroid shot. We could do maybe prolotherapy was starting at that point, but there certainly wasn't stem cell therapy that a lot of people were doing. Certainly not PRP. So I decided I want to do sports medicine. Then I got out and since that time I've sort of just been trying to figure out where I am, and got more and more into lifestyle medicine and just really understanding the role of inflammation and the role of oxidative stress, and the role of again these comorbidities that we can really address, and so I've just pushed further and further into lifestyle medicine, and and holistic care and I guess health span medicine, where sort of that where we understand we want to add years to our life and life to our years. But it's sort of sad when you have patients coming in with the same sort of story, whether they're 40 years old, they're yo-yo dieting, ultra processed food, low in fiber, frequent fast food, limited exercise, their gut health, they have IBS symptoms, they're using antibiotics, fairly high in stress due, if it's a 40-year-old female taking care of her husband, kids, and possibly, a job, or just trying to maintain the house, not drinking enough water, this woman ends up with thyroid disorder, autoimmune disorders, and then it just progresses from there. Or you have a 52-year-old male, again, high stress, trying to support the family, working hard. We've got a lot of work demands, so he's got poor sleep. He's not working because he's, going from, waking up in the morning, jumping in a car, getting to work, sitting for hours, getting off, maybe quickly going to the grocery store, then sitting down to a meal, watching a quick show with his wife and kids, and then to sleep. And it's the same sort of process, not drinking enough. He's got a little heartburn because he's eating too fast, too quickly, not sitting down, eating these large meals. He ends up having a metabolic disease, insulin resistant, and heart disease. And then you have the older guy, 60, 65, or female, again, not moving around much. Now they've got some joint aches because they haven't been moving around for most of the year. They're stiff. They just don't feel great when they exercise. They probably have some insulin or metabolic inefficiency. So now they get hot and sweat. So the uncoupling protein versus the mitochondrial. They're chronically worried. Their kid, politician, when they can retire, if they're going to have enough money. Their sleep's interrupted. Again, they've had long years of antibiotic use now, not enough fiber, so they're constipated. They're also not drinking enough water, maybe a little bit too much alcohol, and they end up with neurodegenerative disorders. But all these stories sort of have the same sort of feel to them. And you're just like, as a primary care physician, again, you're sitting here hearing this and you're like, where do I start? How do I, in a 15-minute visit, how do I get these people to understand when they're resistant to it anyway? I mean, I've sat with again, fortunately, it's the minority of people. Most people will listen to me, at least, if they don't change their behavior. But I've had people to, tell me to effing do my job and give them what they came for, which is, medicine. What are you talking about? Start exercising. That's not medicine. That's not going to get me healthier. I mean, it's remarkable the lack of understanding and the lack of sort of this ability as a primary care physician to really address and help people move towards health rather than just sort of manage this chronic disease. So again, I'm burnt out, and I've started my own practice called Advanced Wellness and Longevity, where I really want to help people understand where they are, what's under the hood, and move them in a direction of health rather than chronic disease.
Wow. Well, to the guy who told you to F off and do your effing job, like, I really hope that person enjoyed his new position. I hope that was the end of that right there for you. And I would just think, like, all those examples you gave, I'm thinking, I'll bet you 100% of those people say, it's just aging. This is just what happens. Happened to my aunts and uncles, happens to my neighbors. It's just normal to be creaky and to forget things in your 30s and, end up with Alzheimer's at 55. You don't realize, like, these are chronic diseases that they do not have to be progressive. You can do something about it with your lifestyle.
Well, that's the amazing thing. People blame it on families all the time. And yes, genetics play a role, but you'd be amazed. It's maybe 15, 20%. I've rarely actually ever heard more than 15% that contributes to disease in scientific studies. So let's just say 20% at the very most. And the reason that you see it in families is we have the same microbiomes. You get one microbiome, you go through, hopefully you go through the vaginal canal. If you don't, that's, another step in the wrong direction. But you go through your mother's vaginal canal. Believe it or not, your mother's microbiome in the vagina changes in that last month of pregnancy, specifically for you to go through and for your gastrointestinal tract, your nasopharynx, to be populated with beneficial bacteria. I mean, it's an amazing story, but one we've moved away from just in that very part. But again, this belief that it's familial is because more of patterns of behavior what you're doing, sedentary, watching movies versus exercising. You sort of do what your parents do. You're as stressed as they are, you're as anxious as they are. You don't manage stress or anxiety or depression well. You're angry, et cetera, et cetera. You look at this, I mean, this is an extreme, but if you look at an ACEs score, I don't know if you're familiar with an ACEs, but it
No,
talks
could
about,
enlighten us.
yeah, it's a pediatric sort of score where, are you brought up in poverty? Are your parents having troubles with mental disorders, or anybody, grandparent who lives in the house with disorder, mental disorder? Is there homelessness? All these sort of things contribute to an increased ACEs score. And again, there's no genetics to that. It's where you're brought up. And unfortunately, these folks have an increased risk of chronic disease, and just like their parents did. And so it's tough. But even in those of us who are fortunate enough not to be homeless or have poverty or mental disorders, or substance abuse issues, we have similar behaviors to our parents and land up with the same cardiovascular cancer that our parents do. And we grow up in the Midwest where there's a lot of glyphosate sprayed, or our parents sprayed glyphosate because their grandparents did to get rid of the weeds, which were annoying, or whatever. You get the idea. It's more behavioral than a genetics thing.
Yeah, very well explained. I like that. As you're going through this process and seeing what the medical system's like, getting burned out, figuring out there's a new way, these stories always coincide with a personal story of how you were evolving your own health and the things you got into. You mentioned getting into endurance sport. Can you tell us a little bit about your own personal health? Maybe learning some of the things you learned along the way, your own personal nutrition, anything along those lines?
Yeah, absolutely. So, I would say I was brought up with a more sort of in South Africa even. I mean, we did eat a fair amount of veggies, but there was still some processed eating, some convenient eating, but we ate pretty well. When I moved to this country, it was primarily, I lived with my dad, and we ate out of these soup. They're like oodles of noodles, I think they were called. And we had so much of that with some, gluten toast. That was our dinner. Because, yeah, exactly. My father was just trying to he was coming from South Africa. He was working his butt off, traveling 45 minutes. We lived in Baltimore, and he in one of the suburbs. He was going all the way down to Glen Burnie. And so he was just trying to provide. My mom was cleaning up South Africa and our house and selling and all that stuff. And so we're doing, and then, we'd go to Burger King. I thought that was delicious, just really not great. And then, so the high school, college, Mountain Dews before, like a big gulp Mountain Dew before tennis practice, just to get us jazzed, probably because we didn't sleep that well, probably too much alcohol, just not great lifestyle. Medical school was horrible. We didn't get anything. There was nothing about nutrition in medical school, nothing. And not only that, but we stayed up late, either studying, or when we were finished an exam, we'd go out and let off some steam. And the night would end at Waffle House or Taco Bell. And I mean, it was ridiculous. So even though I was exercising, I was putting on a little bit of weight, and I'd say my journey ended up, I'd say, at about 230 pounds at 6'2", which is not massive, but unhealthy. I was looking at my cholesterol, and it was not great. My HDL was low. My cholesterol was pretty high. Again, we can argue whether that's important. I do think that my levels, so I had a higher triglyceride, a lower LDL. Some people like a higher LDL, lower triglyceride, and the studies seem to bear that out. But and my sugar was not good, my morning sugar, etc. And so I started on this. I actually started as vegan. I had horrible allergies. I was with this guy, Zach Bush. I don't know if you're familiar with Zach.
Yeah.
He started a thing called Revolution Health Center down here in rural Virginia. And he and I seemed to be aligned in what we espoused. And he was a massive proponent of veganism. And so you look at some of the studies and, and some of these, the China study and the guy for responsible medicine up in DC. I mean, there's a lot of examples of guys who've, improved their patients' health. Ornish, you look at, and pretty interesting things. I was like, well, I'll give it a shot. And interestingly, I did feel better. But what you come to realize is there's a lot of diets out there and a lot of beneficial diets. But I think what we have in common here is just getting rid of the processed foods and the sugars, which
Agreed.
is paramount to any one of those diets. But anyway, I did go vegan. I did feel pretty decent. My numbers did improve. But I didn't love the diet, quite honestly. And so through time and talking to other very intelligent scientists, I've sort of come to more, I guess, a keto, high fiber keto sort of approach more recently, or higher fiber keto approach as much as it allows. I'm not so super serious again about it. I do just prefer keeping processed foods out of my diet. And the one thing I'd say more recently that I've done, I continue to do aerobics. I do try to aim for a zone 2, zone 3 at about 2 hours, 2.5 hours a week. As I'm getting older, I do have cardiovascular disease in my family. I do have cancer in my family, quite a bit of it, certainly depression. And so that 20% or 15%, certainly want to minimize that. I don't want to ignore it. But what I have done is really gone to a lot more resistance work, which I thoroughly enjoyed. I never thought I was going to. I was a big aerobics guy. I ran most of my life. Then I cycled a ton. And I've just thoroughly enjoyed this. But what do you need to grow muscles? Protein. And it's really hard to get adequate protein and not like an unbelievable amount of carbs, if you're a plant-based person. So I've sort of swung again more towards just ensuring healthy fats, really well-sourced protein, and then the fiber to support that.
That must have been really difficult to hear. Even back then, that's quite a while ago, that you hear about keto and ketosis. People are eating more fat. Like that would be so hard to be a clinician practicing. Like, what are you talking about? Eating fat? That's the stupidest thing you would have ever heard at the time, right? Like that would not like penetrate the consciousness, I would think.
Yeah, I mean, absolutely. It's so, yeah, and so intuitive. I agree. Like, coming out of allopathically trained and, you needed to be low fat, carbs. I mean, even today, Casey, it's so frustrating. I get these chronically ill patients who are seeing these specialists. The worst of it is the oncologists who are so worried about cachexia, which is, sort of muscle loss, weight loss, that they're just telling people to eat whatever. And it drives me batty. It's so frustrating to me how people can't understand that what you put into the system is imperative, how you're supporting the cell, the mutations within the cell, the mitochondria, the metabolic efficiency, the metabolic flexibility. How you can't understand that is mind-blowing to me. And so, that is definitely frustrating. But yeah, when I was going through, you talked about fat, you were insane.
Yeah.
I mean, you talked about leaky gut, you were a pariah, you were some quack, and so it's interesting how we sort of turn our nose up to so many things. And lo and behold, if we were just a little more humble and listened a little more carefully and understood that somebody may be coming from a perspective of interest, and lo and behold, it might help your patients. And then I started seeing it as my mind opened, and I started seeing these people come in keto. The first time I saw carnivore, I was like, "Are you insane?" But then I saw the numbers, and the numbers didn't lie. And this guy was happy for the first time. He was losing weight. He was happy. His numbers improved. I was like, "Holy moly! Something's happening. Something's absolutely true." I think he's added some fiber. I think I've convinced him. I am a big fan of making sure that gut is happy. With just that one line of cells. I do think we need to have a good mucosal layer. I do think we need to have a lot of beneficial bacteria, and I do think variety of vegetables can really help with that, feeding the bacteria, which then improve the mucosal layer and provide those butyrates and propionates and the different small chain fatty acids that isopropionates um, that feed the colonocytes, and the colonocytes do well with, the brain does well with, and I think our mitochondria do really well with.
Yeah, that's really well said. I will have a question or two about the carnivore perspective for you in a minute. I thought it was nuts too, man. Like I have to say, like the first podcast episode I ever heard about it, I turned it off halfway through because I'm like, this is the stupidest thing I've ever heard.
Yeah.
And on the oncology thing, this is something I've talked about a lot. But my mom was diagnosed in '98. We went on a low-fat diet. We had as many Twizzlers as we wanted and white bread, and we got skim milk. And we would bring her. I have distinct memories of bringing her the giant caramel apple cider whatever from Starbucks or Jamba Juices for her chemo treatments. Like it was a nice treat for her to have. Yeah, like that's pretty much like the worst thing you could ever do.
Yeah.
Yeah, it didn't go
I
well.
mean, I just before treatments may have increased the uptake of some of that chemo, maybe it helped a tiny bit, but Lord, long term, that's just a terrible, terrible,
Not
terrible.
great. Yeah, not great.
Yeah.
Okay,
Yeah,
so
just awful.
interesting.
Boy.
It's
But it's still happening today, Casey, and
I know.
Yeah.
I know. It's wild. It's wild. Yeah, I can't get over it. I'm glad you're as upset about it as I am. It's pretty upsetting. Okay, so being burned out of the medical system is one thing. It's also like it's your livelihood. This is how you are trained. This is how you make money. If you want to practice outside of the system, it's not that easy. It's not really set up for you that well. And so what was the cognitive dissonance like of like, well, this is what I do professionally, but I also really want to help people. Eventually it means a lot of people have to take a step out into the dark and do something that's not really guaranteed and is not really all that comfortable. What was that process like for you?
Yeah, I mean, again, when you're in the system and you're willing to listen, you hear and you see the changes that people have made by adopting a different diet, like a ketogenic diet. And you're just like, or a vegan diet, Mark Hyman's, paleo vegan or paleo autoimmune protocol. And you see these changes, this Hashimoto's protocol or Wall's protocol. And you just hear these incredible stories of people's lives impacted, getting off medicines. And you start reading studies where, hey, if you do this lifestyle while this, and this, again, going to that synergy, and you hear about this, you're going to be moved. I mean, at least I hope you'll be moved to make a change and do something and want to make a change in your patient's life. Because again, I'm practicing healthcare, not chronic disease management. We do have an amazing system. If you have an acute injury or acute inflammation, we have the best system in the world probably to deal with that, right? And we do have a lot of people that need that lifeboat, that surgery, that procedure that's going to save the life. I couldn't want to be in a better place. But if you're talking about chronically diseased, and we need to understand, and this was an aha moment for me, was okay, so our cells are designed to create inflammation. That's actually a good thing. We want to be able to signal, hey, I need help. We want help. We are communal, commensal human beings. We want help from our neighbors, whether it's another cell or a white cell, or in real life, our neighbor, friend, police, whatever. We want to be able to signal, hey, I'm in trouble. So our systems are incredibly well designed. It starts making a ton of sense that the mitochondria not only are making energy, which helps us in every way, but they also create these reactive oxygen species, which in an incredibly well-designed system and a well-balanced system are balanced. We can negate them, we can keep them calm. Those electrons which create sort of the Hulk, I'm going to destroy, you calm them down. With that woman, the what was her name? Anyway, she can calm down the Hulk, Black Widow.
That's funny.
So you have the system that's balanced, and you're creating these things. And then if the system comes out of balance and the cell needs help, you signal to it so things come down. these electrons have now created some change in the mitochondria or your DNA and unwrapped your chromatin, and now you have well, I don't want to get too detailed, but these sirtuins and cell senescence and all these things happening. But instead of the cell just becoming senescent, it can signal I have a problem, and the immune system either comes down or the cell itself takes care of autophagy or apoptosis or whatever needs to happen. And you go on with your business, and you're doing well and you don't develop diseases. But the problem comes in is when we're not balanced. And again, with all those examples I said earlier, we're just creating more and more inflammation, more and more oxidative stress. We're getting more and more toxins, which is further poisoning the system. And we're getting sicker and sicker. And you want to try to help this person coming in with these complaints, but management. I worked for a hospital system for a period of time, and I had, I was doing all these procedures, and I can't remember what they call them, VIUs or VCUs, or there's this marker of how well you're doing and how much money you're bringing in. It's not a dollar. They give you a number to go along with how much you're bringing in. And I was doing well because I was sports medicine trained, so I was doing fracture management and all these things. And I was covering my cost and the cost of all the overhead, and people don't realize how much overhead doctors have. It's insane. But anyway, on the other side of the table was this hospital administrator just reeling me about how many patients I was seeing and how slow I was, even though I was doing what I needed to do and providing good care. And so I obviously didn't last too long in that system, because I wanted to jump across the table and not do, kindness to this person. I'm a kind person, so I didn't. Anyway, come full circle, I went back into the primary care world, into this practice that was very much about the patient. We would see only 14 to 16 patients a day. But Steve, we were not making it. We were not making our nut, because now the insurance company is telling us how much money we can make per visit, blah, 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 per code. And we have this incredible overhead. So now we get in a management team, and guess what? Now the management team's again telling us we need to go to 15-minute visits. My brother does 6 to 10-minute visits. He's a primary care guy. He's really efficient. He's really, really good at what he does. He does not practice the way I do, but I'm very proud of him. He's very efficient. He's done very well for himself. But, if you like me, and I'm only seeing 14, 60, and I'm being told, plus I have all this overhead. If you look at how, and again, I'm not crying, but because I still do okay, but if you look at how much primary care doctors make on a scale of low to high, I'm way down here. You don't even see what I make. And so this management team who wants to make a profit, they come in and say, yeah, you need to go down to 15-minute visits. And it's really, really difficult to sit down with somebody and help them understand inflammation and oxidative stress and why it's having a role with them, and draw it out for them so they understand it, help them understand the microbiome, help them understand stress and the role it's playing with them in sleep. In 15-minute visits, when they have a bunch of comorbidities, a bunch of concerns, side effects from medicines, all these things you have to deal with. And, you're already running behind because you're trying to tell them about, the role of the nutrition and the role of sleep and the role of stress and the role of the microbiome. And so you just get burnt out, especially when you're only affecting 10 to 20% of the people, because of the limited amount of messaging we can do. And so it just becomes sort of a burnout, unfortunately.
Yeah. Well, it's amazing that you had the courage to step out of that system, though, and do what you're doing today. And if you wouldn't mind, tell us about your clinic and some of the work you're doing. We talked about synergy and how important that is in all things. And I would think about your work the same way that I see it with clients sometimes. Like if we can, get a win with nutrition, it's probably more likely we're going to be able to get a win with exercise, and then maybe your sleep will improve. And it's this like positive upward spiral where, like you said, a synergy is 1 + 1 = 5 or 10 or whatever. Like they're all adding up together. So tell us about some of the tools, besides talking about nutrition and inflammation and that kind of thing, that you're using in practice now.
Yeah, I mean, absolutely. I think the microbiome is pretty important. Again, this butyrate, water, and where you're getting your water from and how you're hydrating. Recently, I mean, I've known about the different forms of hydrogen and this incredible hydrogen atom, whether it's deuterium or regular hydrogen, and the forms that it can take. And there does seem to be some really interesting studies on hydrogen gas, so hydration and the role that can play. Most of us are inadequately hydrated. Even if we're getting water into the system, are we adequately hydrating the cell? So what's that energy around the cell doing? I do have behind me, I think it's blurred out, but a NICA device, which does do phase angle, gives us a sense of that energy around the cell, how readily you're going to be able to move things across that membrane, including water. So are you adequately hydrating the cell? Stress and certainly understanding breath work. I love James Nestor's book on breath, really just helping people understand that this incredibly simple tool that we have at our disposal 24, well, hopefully not 24/7 because we're sleeping, but even during sleep, mouth taping and,
Yep.
so certainly, yeah, I'd say 24/7, this very simple tool that we have that can have a massive effect on our health, our blood pressure, our cortisol, how much stress we're under, our adrenergic versus, sympathetic versus parasympathetic system, heart rate variability, all these things that are incredibly helpful in helping people help drive people to health. And then I certainly do some red light therapy. I'm a proponent of red light therapy. I have a handheld device, but I would love a Thor device. They're just a little bit expensive at
They're
this
pricey.
point, to say the least. Yeah. Um, and so trying to push people to this whole sort of understanding of stress and how we sort of moved away. So I think I'm just sort of jumping all over the place, so I apologize, but how we sort of moved away, especially in our youth, moved away from sort of challenging dopamine or challenging our brain or challenging ourselves to some sort of legitimate stress, not just, political stress or worrying about, are we going to be able to, you know, get to the next level of call of danger or call of whatever, call of duty. But a legitimate stress like going out and feeding some animals in cold or doing a fast or cold plunge, which are really really quite challenging, or really hot sauna followed by a cold plunge, going out and helping the homeless, working on a car and trying to figure it out, changing brakes, whatever, just really sort of stressing the system. We're sort of just continuously feeding dopamine with all these different things that we do. And that has a true impact on, I think, our mental health. And so many of my patients are stressed and have mental health issues. So really trying to help them understand that part of health, I think, is overlooked. Getting off these devices and really going out and instead of, watching somebody else play pickleball or how good they are, or how good they are at basketball or skiing or mountain biking, go out and maybe don't try what they're doing because they are insane, but just go out and ride and get into nature. Play a game of pickleball in a community. It's so much fun. Maybe not the most extreme sport, but fun and a community-based
It's a
thing.
blast.
Yeah, it's super fun. Instead of, again, just being on this phone or going out and working on a house instead of watching somebody else build their house.
Yeah.
So again, I'm really just trying to again help people understand the role that their system plays, the role that physiology plays, neurotransmitters. Again, we're a system, but the gut and how the gut influences the brain how it influences the gut, the vagus nerve, toxins. Certainly, I employ detox, again, going back to sauna, but doing detox, natural detox, and that's where I do use phytonutrients. So cilantro, chlorella, okra. My company was the first to create Somara Labs, sulforaphane, which has been touted as nature's strongest detox by, again, turning on NRF2 and glutathione and the true benefits of that. So, I make sure people understand that the air we breathe, the water we drink, the food we eat has some toxins in it. Make sure you're if you can afford to, you're eating as well sourced foods as you can. Um, Limiting the toxins, certainly if you have an exposure, like here in Virginia, we didn't live in California, but when they were having all those wildfires out there, you could look at the mountains and you could see there was a definite difference. And these air pollutants are harmful. And so talking to people about doing detox, if by gosh you smoke, talking to them about sort of detoxing those out. I talk ad nauseum 1, 2, and 3 about smoking cessation. Um, so getting those out and doing a detox, really, really important.
Yeah, I love that.
Um, so numerous, and then obviously I have the supplement company, and I do talk certainly about my supplements, but also other supplements that can be super helpful. There's one of the things we're struggling with currently in medicine. Well, some have actually taken it with open arms. Somebody like me, I struggle is these GLP-1s, super helpful for a a subset of people. I think they can be very, very beneficial. I tend to want to maybe use the SGLT2s a little bit more, but the GLP-1s, man, what a great tool in a small portion of people. But Lord, just about everybody. I mean, I'm just amazed at who's on a GLP-1 at this point, just for this weight loss. But what they don't realize is the effect it's having on the gut, the effect it's having on muscle mass, things that are not beneficial, and how long you have to be on it to limit the sort of rebound that happens when you come off it. I'm just worried about these meds. So my company came up with another option called GL Perfect, kind of a play on words, but GL Perfect, which has ECGC in it, alpha lipoic acid to sort of stoke the mitochondria, and then berberine, which in some studies has been shown to be as effective as metformin.
Yeah, that's right.
So helping blood glucose, and then EGCG has numerous different benefits from a metabolic standpoint, metabolic flexibility. So we've had some success with that.
Yeah, wow, that sounds amazing. Um, and yeah, I'm listening to you describing some of those really fun activities, like getting out on the trails and playing pickleball. And for the person that heard you say that is thinking like, oh, that I don't know, my knees hurt, my ankles hurt, I could never do that. It's so hard. It's like if you can fix some of these metabolic issues, that could be you. Like you can get there. Trust me, you'll be the one wanting to go do those things because you're feeling so good once you address the root cause of those issues.
Absolutely. I mean, we see that a fair amount is once we start addressing all these things that contribute to inflammation, we stop being so inflamed, right? Again, that is an investment. That's hard to do. We have to help people understand that. But man, it's so easy once you understand it that it just becomes a habit. But getting it to be a habit is really challenging for some of these people. I mean, Casey, if I had a quarter for every time I heard somebody come in and say, gosh, Dr. Katz, I wish I listened to you 5 years ago or 10 years ago. I've made the changes now and what a difference it makes. I'm like, oh, if I just knew that key, what that key is to turn that person on to this sooner, it would be amazing. Unfortunately, I haven't figured that out. I don't think any of us have.
Call me when you
But
do.
it's really, again, up to the person to understand. It's, again, this understanding we have essential needs, right? As people, we have essential needs. Part of that is connection. If you look at the blue zones, or you look at, I can't remember her name, the woman who wrote the book on radical remission with regard to cancer, and then now she's recently written another book, Radical Remission with chronic disease. Some of the things she talks about are true to these human needs. We like growth, we like connection, we like purpose. And so we like to contribute. So connection, contribution, growth, and purpose. And as long as we're doing these things actively, that can answer a lot for us. And again, can work synergistically together. So if we just connect, and we're out hanging out with our buddies and, happy, that might get us so far, but we're not really contributing to growth. So, or contributing to anything or finding our purpose yet. So we may be a little distracted or stressed about those other reasons. But when we put them together, they work really, really well. And that's what sort of these complete remissions in the blue zone sort of show. You don't have to be perfect, but if you're addressing these things and engaging in these things, it really can do a lot for health span and longevity.
That connection piece is just so critical and something that shines through in all of those areas that they go to for sure. Um, uh, there's another tool that you use that I would love you to comment on what your experience has been like using a metabolic cart. I was fortunate enough to use a metabolic cart in my career for over a decade. I loved it. I got to teach other trainers how to interpret the data and train people on it, and help people manipulate things that they didn't think could be manipulated, or explain why caloric restriction doesn't really work as well, or how to get endurance athletes to burn fat and like go longer. Like, what has your experience been like working with a metabolic cart?
Yeah, it's funny. I had mentioned this earlier. I started with a metabolic cart probably 20 years ago. I joined an athletic center here in town. We were one of the first. We probably were a little ahead of our time, but it's ACAC in sort of central Virginia, and then they own some stuff in Maryland and Pennsylvania. But a great group. They started something called the PrEP program, physician referred exercise program, which is just really smart. Unbelievably, they weren't even studying that. So when I became their physician, I was like, we got to study this. But anyway, they were ahead, we were ahead. And at that point, I think 2008, I got a big metabolic cart, this huge thing. I had a really nice treadmill, really nice bike. The owner was so giving in supporting my sort of dream and sort of vision. I had an ultrasound to do stress echoes, lots of things. I think I told you I had a bot pod. So I had all these tools, and just realized the importance of helping people understand that their metabolic equivalents, their METs, and how it related to VO2 max, what they were burning, their metabolic flexibility. So if it was just carbs and their respiratory exchange ratio was up around 1, probably not too excellent. If it's down around 0.7 at rest, and then as you progress through, it goes up, perfect. You've got some metabolic flexibility. What your minute ventilation to VCO2 is as a sign of cardiovascular and lung function with VO2. There's so many markers that we can get, but again, if you don't understand what's under the hood, what's happening, it's really hard. So once you start giving people, data, it can really make a huge difference to want to. The other thing I use, by the way, are CGMs, continuous glucose
Cool.
monitors. Those are amazing at helping you. How accurate are they, and how great are they? We can argue, but they do give people some real data on what they're doing and how it affects their metabolic flexibility, how they're using glucose, what happens to glucose, what foods affect their glucose, how stress affects glucose. I had this one guy, big business owner here in town. Unfortunately, his business was going south. He was a big developer, and the housing thing hit, and he was really struggling. So much stress, and he was meeting with a personal trainer, and he had really listened to me as far as diet goes. But when the stress hit, it was unbelievable. He's hard for him to get his blood sugars, and the CGM was showing it under a certain, I think he couldn't get under 150, 200 when the stress was high, that cortisol effect. It was unbelievable, regardless of what he did. Unfortunately, again, some of the stress to driving back to not so great eating, and then all hell broke loose. But he actually ended up getting so much data, he realized he had to leave the business. He sold it. He realized it was no good for his health. So again, CGMs, but again, I now have this metabolic cart that's super mobile, super easy. The masks, when you're wearing them, yeah, they're not that comfortable, but it's only 10 minutes at the most, 16, 20 if you're really in good shape and you can really do a high VO2 max. But yeah, it's really good information, and understanding how your VO2 max impacts your longevity and your lifespan is crucial. I think Peter Attia has done an amazing job with that.
Yep, he definitely has. Yeah, getting that message out there is fantastic, and yeah, I really enjoyed my time using that as a tool and showing people how to like accelerate their fat burning. If nothing else, maybe show some people that they're just working out way too hard, need to back off a little bit, things like that. Just a wonderful
Yeah.
tool. Yeah, so cool.
Yeah, that understanding of exercise being a stress and helping people understand that, you want to be stressed. You got to break things down to build things up, but you got to support that. But there is that apex there of, if you go over that mountaintop over to the other side, and now you're getting into overtraining, that can be a real problem. So
So
yeah,
so
great
so
tool for that.
much, yeah, so much of what we're talking about today is the chronic nature of things. We talk
Right.
about cortisol as it's a bad hormone, it's a stress hormone. Well, it can be bad if it's always high. Hormones need to fluctuate. Insulin is a good hormone. It's not good if it's high all the time, but it's a good hormone. It needs to fluctuate. And
Yeah.
just like you were talking about earlier, like having balance and all those things is great, and having hard workouts occasionally, doing occasional strength training that's very, very difficult is awesome for you. And then you should probably take a few days off and go on walks and enjoy movement. Yeah,
Absolutely.
yeah, I love that. I do have to ask you two questions from kind of more of the carnivore perspective, and I want to
Yeah.
ask these from the, I guess, intention of understanding. We get very myopic, and obviously, you're talking to a large cohort of people that do follow carnivore diets, and they are told by people what I have been told, and I, somewhat understand that fiber it is in some cases can be good and in other cases can be not necessary. We recommend low fiber diets for some people with IBS and IBD and Crohn's and digestive issues. It's warranted sometimes. And I see it in my own life. Like I've been carnivore. I'm coming up to 6 years of being on a carnivore diet. I feel great. My digestion is awesome. I'm not planning on stopping anytime soon. And I've watched my wife go through the same journey. She's been carnivore and it didn't go as well for her. And she's now back on eating things like broccoli and vegetables. And she feels weird about it because we're living in the same home and she's cooking up broccoli in my house and thinking like, well, isn't this bad for me? And I'm saying, well, no, it's not bad for you. Like, do you like it? Do you feel good? Does it help your digestion? Then you should keep doing that. So again, we're told that some of the supplements that you make, which your supplement company looks amazing, but
Thank
we're
you.
told in the carnivore community that these are phytotoxins. If you take these things in, these components of broccoli and salicylates and oxalates and phytates and lectins, and go down the list of all these different things, and in certain doses, they're too much and they can cause problems. Um, in your observation, where have you seen that do many people eat too many vegetables and need to back off of that? Is that something you see in like your day-to-day practice, or is that something we're maybe kind of over emphasizing a little bit too much in the carnivore community?
It's a great, great, great question. Yeah. So um, again, I think again the most important thing is how we can find common ground. So I applaud you. You're not eating processed foods. I'm hoping you're sourcing your foods really, really well. And you found health, and that's amazing. So you're obviously not eating sugars because that would be completely against carnivore diet, and all that is really, really important. Um, I would say, you know, in the processed food world, in the world we live in, our microbiome is not healthy, right? And so if you ask somebody to change that and get rid of toxins, they're going to see an improvement. If you ask somebody who's maybe eating a keto diet, that maybe not the best well-sourced foods, maybe not that great, maybe have a limited microbiome, you start asking them to eat vegetables and increase it over a period of time, they could really, really struggle because their microbiome is not going to be able to handle it. If they've been doing some other, if it's not that well sourced, or they've been doing some other toxin, or they've been exposed to some other toxin, they may have leaky gut. And this is certainly true of the person in ultra processed foods. I think we don't even need to mention that. You start asking those people to get healthy and start eating, any one of these people to start eating vegetables. They're really just going to feed an unhealthy microbiome, right? And this is the problem. So if the fiber is there, in my opinion, to feed the microbiome, right? So we got to start there. So do you have a healthy microbiome, or do you have an unhealthy microbiome? And you can have an unhealthy microbiome on keto or carnivore, and you can certainly have an unhealthy microbiome on an ultra processed food diet, taking too many medications, eating too much sugar, similar, or any diet, right? That's not healthy. And if you're feeding, or if you take too many antibiotics, so if you're feeding now an unhealthy microbiome with fiber, you're going to get more lipopolysaccharides, all these endotoxins, because you've got a leaky gut, and you're going to have inflammation, and you're not going to feel good. And so fiber looks bad. I agree, right? But now if you go carnivore, you go keto, and you're sourcing really well, you get rid of sugars, you get rid of all the crap that we're putting in our body, and you source your fiber well, and you feed, and you start, maybe, I don't know if you've read Super Gut by William Davis.
Yeah,
You
yeah.
start, giving your body these beneficial microbes that grow beneficial microbes. They're very positive to other beneficial microbes, commensal microbes that are going to help the system, that are going to teach it, that are going to decrease inflammation, that are going to feed the colonocytes, that are going to tighten those tight junctions back up. We haven't talked about gap junctions, but we'll leave those alone for now. But strengthen those tight junctions back up. You limit inflammation. Remember, 80%, 70 to 80% of our entire immune system is sitting around the gut. If that is not healthy, you're having antigens go across, or lipopolysaccharides or endotoxins, the system's going to be a mess. So it really depends on what you're feeding it, or what you're feeding, should I say. So we got to start there. So if you've improved with a carnivore, and now your wife starts increasing fiber and feels fantastic, that makes total sense to me, right? She should love that fiber, because now she's improving commensal bacteria. She's feeding bacteria that are really beneficial to her. She's improving that mucosal lining. She's improving the health of the colonocytes. That enteric nervous system's happy. The vagus nerve's happy, and she's healthy. Totally makes sense to me.
Wow. That's awesome. Such a good
Yeah.
explanation. I really, really appreciate that. And yeah, like we said, we always want to try to find common ground. And it's like your book, right? You write this amazing children's book. It's so well illustrated. I love it.
Thank you.
If I don't have kids, if I had kids, they may have less access to vegetables than your kids may have. However, However, when I go to the park where there's soccer fields, I don't see banana peels and apple cores. I see packages of straight up sugary junk.
Oh my gosh.
I would way rather have kids eat some baby carrots and have some celery. That's going to be way better than what they're actually fueling their bodies to do, like a 30-minute or 60-minute soccer game. You don't need a gallon of Gatorade and all these
No,
like candy bars and gummy treats. Like, it's ridiculous out there. And so getting
it's
anybody,
unbelievable.
oh, it's crazy. So just getting anybody
Yeah,
to whole foods, eat foods that came from the earth or came from animals, is such a
right.
huge step. And whatever path, however much you want to get into, fiber or not, or whatever, like yeah, that just doing that one step alone makes us 99% the same.
Yeah, absolutely. Totally. And I'm psyched for you that you've had such a positive health journey. And again, I've had patients who've come in carnivore, and I've just sort of shook my head going, what in God's name? And the numbers speak for themselves, the blood pressure, how they're feeling, their mental health. It's amazing. But again, I do believe it's just getting away from this processed world stuff and onto something that's much more beneficial for them.
I think that's totally reasonable. And I really appreciate that explanation. And yeah, I just
Yeah.
wish all of us would be a little bit more critically thinking about, yes, maybe this got us to this point in health. And yes, we can maybe add other things in at a certain time, and it's not going to have the same impact. And yeah, it's always an evolving thing. It's a moving target, which makes nutrition very difficult and frustrating at times, but it also makes it really fun. And to be able to chase our own health for all the things we've discussed, to be able to have fun, to have connection. At the end of the day, we're here on this earth for a very short period of time, and it doesn't really matter how much weight we can push in a gym. We want to just be, like you said, we want to enjoy longevity and health span at the same time, and enjoy our children and be around for our grandkids and be healthy. And at the end of the day, that's kind of the point of all of this. So yeah.
Yeah, for sure. And to some degree, it does matter what weight you can push, but not
True.
excessive.
True. Good point.
Yeah,
Good
that
point.
grip strength and that hang, and being
Yep.
able to, eccentrically contract, really important.
There you go. Totally agree.
I,
Okay, that's
I'm
fair.
I'm to I love the strength stuff at this point.
That's so cool that you were able to transition into it.
Yeah,
I hear that story a lot where somebody just is really resistant to it, and then they get into it, and it's like, wow, this is really fun, and it's hard. It should be very challenging. It should
so
take your muscles to that level, but it feels so good to be able to do that.
So good. And it is hard. People don't want to do it, but man, you start doing it. I'm not going to say it's addictive. I don't have to go. I don't feel compelled like, but I just know how good it is and what it's doing for my strength and my VO2 max and my ability to have a lifespan and a health span. And I have three boys. My oldest is 6'8", 260 pounds. He is a beast of a man. It's one thing, I'm 6'2". It's one thing to look at your son. It's a whole nother thing to look up to him. He came home for Christmas. He's working out like crazy. He's trying to play football. He's never actually played football. He's in a Division II team. The coach was very kind, saw his potential, is working with him. But the guy sat on me because he's so strong that I could not move. I think I still have my 17-year-old. I was doing pull-ups with him last night at the gym, and I showed him up, which I was pretty excited
Oh,
about.
good for you.
Yeah, in front of his friends,
Dad
across
strength.
buddies. Yeah, there's going to be a time that it's going to reverse. And then I have a daughter who's super strong. She's into horses and loves it, and she's always challenging me. And so more mentally, but also physically. And then my 9-year-old, we call him Bear, and he's just an absolute bear. So going to keep up with that guy. I'm going to be, when he's graduating from high school, I'm going to be in my 60s. So
Wow.
yeah,
Wow.
so he's going to keep me honest.
That's amazing. Oh, what a lovely family, man. You're definitely going to go through that transition of, asking the kids to take out or telling the kids to take out the trash and going to like, do you mind taking out the trash? Like asking them to take
Yeah.
out the trash when they're bigger than you. Oh
Too
man, Dr.
crazy to take
Katz,
out the trash.
exactly. This has been an awesome chat. I've really enjoyed this. I've learned a lot. I love what you're doing out there. I knew as soon as I heard that podcast episode that you did with Dr. Hewlett, I really wanted to get you on. And yeah, I really appreciate the way you're approaching things. Where would you like people to go to find you and connect with you and your work?
Yeah, sure. So I did just start this practice, Advance. That's without a D, just Advance, as in the verb. Advanced Wellness and Longevity, no spaces.com. And then Mara Labs, MARA hyphen labs. I'm on that website as well. But Advanced Wellness and Longevity, Martin Katz, MD. I think I have a website there, but you can get everything, I think, through Advanced Wellness and Longevity at this point. And then I did write that little kid's book, Making a Magnificent You. So yeah, I'm out there and trying to plug away and come down to Virginia, come visit me. And we got great trails at Blue Ridge,
I'm
hiking,
there.
mountain biking, and
I'd
the
love to
school
visit.
is incredibly kind. It's a boys' boarding school. The school is incredibly kind. You can park off campus and access the trails, and they're really beautiful.
That's awesome.
So really nice mountain biking trails. Yeah.
Yeah, that's great. We will link to all of that. That sounds amazing, by the way. I would love to ride on the East Coast. I'm stuck here in Utah, so it's a lot of desert riding and mountain riding, but I would love to experience riding out there. And I just have to say, too, we've kind of underplayed this, but when somebody goes to the website for the supplements, there is a 30-day risk-free guarantee on any of these
Yeah.
things. And again,
Yeah.
from the carnivore perspective, I'm reading through and it's like, oh, these are plant toxins. I would challenge anybody to read the reviews. Go in there and see what people are saying about this because people are healing and experiencing amazing events and getting off of sleep medications and
Yeah.
reducing inflammation. So whatever you guys are doing, it's really, really good work. So I just wanted to throw that plug in there. But
yeah, it is interesting from I've read the carnivore perspective and it is interesting where you look at these phytonutrients and in the plant world there are some at times toxins to limit people coming in and eating or doing whatever to that plant, so they're sort of helping a defense. So you're going, well, how can that be good for us? But the way they work at the cellular level is really quite important, from sulforaphane, which works on NRF2, resveratrol, which works on sirtuins, quercetin, which helps cell senescence and stabilize mast cells. It's pretty important. But what people don't really understand is so many of these phytonutrients have been studied just on cells or in mice. But if you look at them on petri dishes, it's very easy to get it to the cell and see a cellular response. But what's very difficult is getting it across the cell membrane, the gut membrane, getting it through the stomach cell membrane or gut membrane into the vascular system and to the cell, and making it have a biologic effect. And that's what my company works so very hard at. So my mother calls me up the whole time. She's like, why do I need to take so many supplements? Why can't you combine? And the reason is, to have a biologic effect, you need a certain amount in there and protect it. And so we have, all the supplements we work on are lipid soluble supplements, very difficult to get into the system. They don't just cross the membrane so easily. Sulforaphane, once it does move around a little bit easier, but they are challenging. Sulforaphane is more challenging from a stabilization standpoint. But resveratrol, so sulforaphane is more water soluble, but berberine and resveratrol and quercetin, much more EGCG, very difficult to get into the system. So we've created a system that is patent pending to get it in. So we're pretty happy. So we're working really hard. John Gildea, PhD, very well published, incredibly smart guy, has been incremental in helping us get this done.
Wow, that's great. Yeah, in my career, I've been paid commissions at times to sell supplements, and by and large, they did not work for hardly anything. And it's a wild west out there. And again, I would just encourage anybody to go to the website and read the reviews, because again, people are getting a lot of really good benefits that I don't normally see other people get on similar supplements that are out there. So clearly, you guys are doing something right, and yeah, it just looks like an amazing resource for people. And just to have the free 90-day guarantee is fantastic. Some of these supplements, excuse me, take longer than 30 days for you to see any kind of impact. So to be able to have that guarantee, I think tells us a lot about the way you're running your business and the effect of these compounds. So I really appreciate that.
Yeah, and John will tell you, unfortunately, because of this whole funding issue, has lost his job at UVA. He was in a multi-million-dollar NIH type funded place. He's brilliant. He's conservative. He's amazing. But we are going to build him a lab so we can continue to improve these products. So we're continuously trying to tweak them to make sure we're getting these things so they're biologically relevant.
Wow, that sounds amazing. What a cool resource, man. Well, again, Dr. Martin Katz, thank you so very much for an awesome conversation. Like I said, I've learned a lot, and I think you've provided a lot of value for our listeners. So really, really appreciate you. Hope we can have you on another time down the road. But for now, thank you so very much for all the work you've done, and thank you for taking the time to be on our show today. We really appreciate you.
Casey, thanks so much. Thanks for what you do. And yeah, anytime you want me back, I'd be happy to come back and chat.
Beautiful. Yeah, I'll definitely reach out for sure.
Yeah,
Awesome.
Thanks for what you're doing.
And this has been another episode of Boundless Body Radio.